Hello, everybody. Welcome to my channel. This is Dr. Spinach. So, today we're going to be talking about how to use the reading time effectively in PLAB-2. Now, if you guys remember, you get 1 minute 30 seconds in Hardman Square and 1 minute 45 seconds in Hardman Street. Outside the cubicle, to read the instructions before going inside through that door. And inside that door, you have a patient and an examiner sitting, or a telephone or video call and an examiner sitting. And this is you. So, this is where you get 1 minute 30 seconds if you're in Square, Hartman Square in Manchester, and 1 minute 45 seconds if your exam is in Hartman Street in Manchester. So, how are you going to use this time effectively? Now, let's just consider that you have 1 minute, not 30 seconds, not 45 seconds. So, how are you going to use this 1 minute effectively to prepare yourself outside this cubicle so that you can go inside confidently and ask all the questions, gather information, and come to a diagnosis? Let's get started for that. Let's take an example of headache. So you have a patient who comes to you with headache. Okay, so you have, let's say, Mr. Paul Williams, who came to you with complaints of headache. Now, please talk to the patient, address his concern, and manage the patient. So, this is the question that you will be given outside the cubicle. This is something that is on the instruction task outside the cubicle. So, what are the things that should come to your mind when listening to or when reading headache? The first thing that you should think about is basically the history of presenting complaints. So you should think about Socrates. So you should think about what you're going to ask for headache. You're going to ask Socrates for any pain situation, for any pain, abdominal pain, headache, let's say hand pain, or pain in body, just overall generalized pain, anything like that, you will go with Socrates. With anything other than pain, let's say example is cough, breathlessness, anything like that would be Odipara. So anything other than pain is Odipara, and anything with pain is Socrates. So you're going to think about what is the site of headache, onset, when did it start, was it gradual or was it sudden? Now, the next thing is, what is the character of pain, whether it is sharp or whether it is dull? Now, does it radiate anywhere? Are there any aggravating factors? Are there any relieving factors? And whether now let's say an exam, and what is the score? If I ask you to score the pain, what is the score of the pain? So these are the things that should come up in your mind. You're not going to think about what is causing this headache first. You're going to think about the the history of presenting complaints that you're going to ask to the patient. Similarly, with cough, you're going to ask Odipara. Okay, now the next thing that you should think about are the differentials. Now, what can cause the headache? You're not going to come to a conclusion that this patient definitely has migraine and is coming to you. No, never do that, because in that case you will start thinking about management, and when you go inside, they might not even have migraine. So you wasted your time thinking of something that was not even present in the patient. So you're going to think about differentials. Now, there is a trick when you think about differentials as well. So how do you think about differentials? The first thing that you think about are the red flags. That means the ones that need urgent attention. So if you think about headache or any pain, so let's just take an example for headache. So what are the urgent or red flag differentials that you should be eliminating no matter what to prove that you are a safe doctor? So what are these? These are Think of subarachnoid hemorrhage, think of stroke, think of giant cell arteritis. So these are some of the differentials that you need to eliminate in this patient. Now, then the next thing that you should think about outside your cubicle is less urgent differentials. For example, you can think about migraine, you can think about tension headache, for example. So think about all the questions you will ask about these, okay? Now, and finally, what else? Finally, you should rehearse what you're gonna start with and how you're gonna start with. So, let's say I'll give you an example. So, I am Dr. Spinach, one of the doctors here at the GP clinic today. May I please confirm your full name and age? So, that is something that you should start with. Why? Because that sets the pace. So when you know your starting lines, you start with confidence, and once you're not staggering there, what happens is you feel more confident, and that sets the pace for the rest of the conversation. That gives the first impression to the examiner as well, and gives you confidence to carry out the whole consultation. So always remember to think about these three things. The first thing is either Socrates or the Oripara. Think of the differentials, red flags first, and then least urgent ones later on. And finally, rehearse your beginning lines in your mind. So yeah, so that is it. So actually, I wrote the example here, and then let's take another example where nothing is given. Okay, where only something like 42 years old Hannah Smith came to you with some concerns. Now, what are you going to do at this moment? Now, what you're going to do is you are still going to think about Socrates. You're still going to think about Odipara. Why? Because maybe she came with some complaints of headache or any pain, or let's say something other than pain. We don't know yet, but let's be prepared. Now, even if it is not there, if it is something else, you don't have an idea anyways, so you will have to go and confront that. But if let's say it turns out to be something related with pain or something else like a history station, then it gives you an extra edge. Now, another thing very important is that she is a female. Hannah Smith, she is a female. Now, for every female patient, whether whatever station is inside, like with some concerns she came, always think about 4 P's, for example. So what are 4 P's? 4 P's are pregnancy, pills, periods, and pap smear. So these are the 4 things that you should think about before going inside. Okay, so yeah, so that is an example of how you can use this time effectively outside your cubicle. I've always struggled to come up with something that can help us as students and everyone who's giving PLAB-2 exam to use this time very effectively, so that we can go inside with confidence and confront our patient and give a good impression to the examiner. So that's it for today. Thank you very much for bearing with me, and if you liked my video, please give it a thumbs up and do subscribe to my channel. Share it with your friends. Any questions? Well, I'm always here to answer them. Post it in the comment section. Have a good day. Bye bye.